One of the single biggest fears my patients from the UK, the US, and Europe have isn't the surgery itself. It isn't even the pain, it's the waiting period. You know you are coming to Turkey for implants. You know the final result will be amazing. But what about the 3 to 6 months in between? Are you going to be toothless? Will you have to hide your smile? Will you have a plastic denture floating around in your mouth? Or can you actually have fixed teeth immediately? Today, I'm going to bring clearance about the two options for your temporary teeth during the healing phase: the fixed provisional bridge and the removable denture. Clinics love to sell you the fixed option because it sounds better. It sounds premium, but is it actually better for your bone healing, or is it a risk that could cause your implants to fail before they even start working? So let's find out. But first, let me briefly introduce myself. I am a dentist currently working as an independent consultant. I do not work chairside anymore. I know this industry from the inside out. Even though this channel is relatively new, I have already had dozens of people contacting me with concerns or asking for guidance. This tells me a lot about the current state of the industry. I never expected to have this many people reaching out so quickly. It's clear that the demand for honest advice is high because the industry is very complicated. This is why I provide a paid consultancy service to patients worldwide. So if you need personalized guidance on your case, please visit my website with the link below and make sure to check the pricing section before you contact me. But before you close this video, know that this information is free. My videos contain a lot of useful information for your next Turkish smile makeover, so make sure you check my other videos too or watch until the end. Now let's define exactly what we are talking about so there is no confusion. When we place implants, we usually need to wait 3 to 6 months for a process called osseointegration. This is a fancy medical term, but it simply means titanium screw is fusing with your living bone. During this time, the implant is vulnerable. It is like a seed planted in the ground. If you kick the seed every day, the roots will never take hold. If you wiggle the implant, the bone will never grow onto it. The implant will fail. So how do we give you teeth without disturbing this delicate seed? We have two main methods. Option A is the removable denture. In traditional dental terms, we call this an immediate denture. It sits entirely on top of your gums. It's not attached to any implants at all. It relies on suction, the shape of your ridge or denture glue, to stay in place while your implants sleep safely underneath the gums, healing in peace. Option B is the fixed provisional bridge. This is often what people mean when they say teeth in a day or an all-on for immediate load. In this scenario, we screw a temporary acrylic bridge directly to your new implants immediately after surgery. You cannot take this out, only a dentist can. It's rigidly fixed. Many patients assume fixed is always better, but as a dentist who consults with international patients, I'm here to tell you, fixed is not always the safest choice. Let's break down the pros and cons in detail, starting with the removable option. Let's start with the removable denture. Many patients hate the idea of this. I understand why. It feels like something for old people. Also, you try to have implants because you want to prevent this option, but as a dentist, I have to look at the biology first. Let's look at the pros of the removable denture first. Number one is safety for implants. This is the biggest factor because the denture rests on your soft tissue, your gums. It does not put direct pressure on your healing implants. If your bone was soft during surgery, or if we had to do a lot of bone grafting, this sometimes is the only safe choice. It guarantees that no micro movement will disturb the implants. Number two is cost. It is significantly cheaper if you are on a strict budget for your trip to Turkey. Choosing a removable temporary option can save you hundreds of euros or dollars, which can put towards better quality crowns for the final result. Number three is hygiene and gum health. You take it out at night, you can clean your mouth perfectly, you can rinse with salt water effectively. This drastically reduces the risk of infection during the critical first 2 weeks of healing. But what about the cons? And I will give you the honest truth because you need to be prepared mentally also. First of all, it is bulky. To get suction, the denture must cover the roof of your mouth, the palate, so food will taste differently. It also changes the volume of your mouth, which means your speech is affected. You might have a lisp for the first few weeks while your tongue learns to navigate to the new plastic on your palate. Stability is also a major issue. It moves, it floats. If you cough, if you sneeze or laugh too hard, it can dislodge. You will almost certainly need to use a denture adhesive like Corega or Fixodent to keep it secure, which can be messy and annoying to clean. One other problem no one talks about is the fact that they produce this in a very short amount of time, which can mess up the stability of the denture even more. Make sure you stay long enough to leave time for the adaptation of your dentures, at least a week. My personal advice here is if you decide for removable dentures, arrive, get your surgery, return, and come back after 2 weeks, because that's the amount of time your gums need to heal from your implant surgery, so your gums. Of course, this amount is impossible for patients coming from far away like the US, New Zealand, Canada. To them, I advise staying at least 10 days to leave more room for adjustment, or a week. A week might even suffice, but don't stay those 3 to 4 days that a clinic suggests you. And finally, the issue of sore spots. This is simply biology. After we extract teeth and place implants, your gums will swell and then they will shrink as they heal. The denture is made from a hard plastic, so it does not shrink. So as your gums change shape, the denture will become loose and start to rub. It is very common to develop ulcers or sore spots that require adjustment. You will likely find it uncomfortable for the first few weeks. Now, let's move on to the comfortable option, the fixed provisional bridge. This is what everyone wants. You wake up from surgery and you have teeth that don't move. Here are the pros. First of all, psychology. It feels like your own teeth. You wake up, look in the mirror, and you don't see a medical appliance. You see a smile. For your confidence, this is unmatched. Second is function. You can chew much better with a denture. We still have strict rules about what you can eat, which I will get to in a minute, but the act of chewing feels natural. Third is comfort. There is no plastic covering the roof of your mouth. You taste your food for 100%. You speak clearly almost immediately because your tongue has room to move. But here are the cons that clinics usually don't tell you until after you paid. First of all is the risk of failure. This is serious. If you have a fixed bridge, every time you bite, you are transmitting force directly to the implant screw and down into the bone. If you cheat, for example, and eat hard food, you can overload the interface. You can cause the bone to die around the implant. Second, hygiene is hard. You cannot take the bridge out. You cannot brush under the bridge like normal teeth, for example. You must use a water flosser and a special super floss to clean underneath the bridge, between the plastic and your gums. If you are lazy with cleaning, food gets trapped, bacteria grows, and you get peri-implantitis, an infection that can cause you to lose your implants because they invaded the loose gums and the bone. Third is it breaks. Please remember, this is a temporary bridge. It is made of an acrylic or PMMA or a resin, a 3D printed resin, but it is basically a high quality plastic. It's not zirconia, it's not metal. If you grind your teeth at night, for example, or you bite a fork, it can snap. This leads me to a very specific point for my international patients. This is crucial for your logistics. For example, if you would live in Istanbul like me and your fixed temporary bridge breaks, you can go back to the clinic, they fix it on the same day usually, no problem. But let's say you don't live here. Let's say you live in London, you live in New York, you live in Berlin. If you have a fixed bridge and the screw loosens or the acrylic snaps while you are back at home, you have a dental emergency. If the bridge is loose, it can act as a lever, wiggling the implant, so you must get it tightened immediately or fixed. However, many local dentists in the UK or US or Australia, Canada, New Zealand might not want to touch work done abroad due to liability reasons, or even if they want to help. For example, they might not have the specific screwdriver or prosthetic kit for the specific implant brand you received in Turkey. You could be stuck with a flapping ridge for days or months, risking your implants. Now, contrast this with a removable denture, for example. If you drop it in a sink and it cracks, for example, it is annoying, yes, but it's not a medical emergency. You can take it out of your mouth and you can still function. You can go to any clinic or a dental lab, dental technician in your local city, and they can fix the plastic in an hour because they don't need to touch the implants or even your mouth. So for patients who cannot travel back quickly, the fixed option comes with a higher logistical medical risk that you must be willing to accept. Now, I want to talk about the diet also. This applies to both options, so removable and fixed, but it is a life or death for the fixed option. Whether you choose fixed or removable, you must follow the fork test for at least 3 months or 4 months if you have grafting. The rule is simple. If you cannot cut the food easily with the side of a fork, you cannot put it in your mouth. So what can you eat? Well, for breakfast, I would suggest scrambled eggs, oatmeal, yogurt, smoothies, soft cheese, bananas. For lunch and dinner, mashed potatoes, lukewarm soups, soft pasta, or overcooked pasta, even better. Fish that flakes apart, ground beef or minced meat, stewed vegetables that are very soft. What you must avoid is this. Absolutely no crusty bread, no pizza crust, no nuts, no seeds, no raw carrots, no raw apples, no steak, no sticky candy, and absolutely no chewing ice. If you have the fixed fridge, you must be even more careful. You have to learn to chew vertically. Do not grind side by side like this. It must be vertically like this, which is also annoying. Side-to-side movement creates lateral forces, which are the most dangerous forces for a healing implant. Imagine pulling a fence post sideways versus pushing it down. Pushing it down is okay, but pushing it sideways loosens the post. Now, let's talk about the specific maintenance routine you will need to commit to. If you choose the removable denture for the first 2 weeks after surgery, do not use it. Let your sutures, let your gums breathe. This will speed up the healing process. After that, use it slowly. Don't try to eat something the first day you use it. Ease into it. Take them off every night. Clean the denture with a soft toothbrush and a non-abrasive soap or denture cleaner. Do not use regular toothpaste on the plastic because it can scratch it. Gently brush your gums and the roof of your mouth with a super soft toothbrush to keep the blood circulation going. Soak the denture in water or cleaning solution overnight so that the plastic doesn't dry out. And remember, as your gums shrink, the denture will get loose. You will need to buy denture adhesive from the pharmacy. This is normal. This is also something I suggest because this adhesive can act as a barrier between your gums and your denture so that food doesn't get stuck. If you choose the fixed provisional, you cannot remove it, so your tools are different. We need a water flosser. Use it on the lowest setting. Aim it underneath the bridge to flush out food debris. You need super floss. This is a floss with a stiff end that allows you to thread it between the gums and the bridge. You must do this at least once a day. If you feel the bridge is moving even a tiny bit, you must stop chewing on it immediately and contact a dentist. A loose screw is a ticking time bomb for the implant. Ultimately, sometimes this choice isn't up to you. It's up to your bone, and it's where the honesty of your dentist is tested. When we place an implant during surgery, we measure the tightness. We call this insertion torque. We measure it in Newton centimeters. If the implant is very tight, usually over 30 or 35 newtons, it's primarily stable. We can safely load a fixed bridge onto it immediately. But if the bone is soft, like styrofoam, for example, and the implant spins even a little bit, or the torque value is low, say 15-20 newtons at max, in this scenario, I will advise you to avoid a fixed bridge. I know you will be disappointed. I know you wanted that smile makeover immediately. I know, but if they load a fixed bridge on a soft implant, it will fail. You will lose the implant, you will lose the bone, and we will have to start from zero again. So that's another 4 to 6 months you'll have to wait. In that case, you must wear a removable denture, or sometimes wearing nothing at all for 2 weeks to let the gums heal first. A good dentist will prioritize your long-term health over your short-term happiness. If a clinic promises you fixed teeth 100% guarantee before they even see your x-ray or touched your bone, run away. They are selling you a product, not a medical treatment. And something I tell every implant patient is you are sacrificing, and this is very important, listen carefully, you're sacrificing 4 to 6 months for a treatment that will last you at least 15 to 20 years. So be patient, and you might even extend those years by another 5. To summarize everything we discussed, choose the fixed provisional if you have a good hard bone quality, which we only know during surgery. So once we open your gums, your budget allows for the extra cost. You are disciplined enough to clean underneath it every single day, and you promise or you swear to eat only soft food for 3 months and are not a grinder or a clencher. Choose the removable denture if you want to save money, you want to minimize all the risks of your implants, you have complex bone grafting that needs to be protected, or if you want the easiest possible repair solution if something breaks while you are back home. Don't let a clinic force you into a fixed option just to make a sale if your bone isn't ready. Honest dentistry is safe dentistry. So I hope this deep dive into the realities of temporary teeth has helped you understand what to expect. It is a waiting game, but the price at the end, your permanent beautiful smile, will be worth it. If you found this helpful, please like the video so more patients, more people around the world can find this honest information. If you have questions about your specific x-rays or treatment plan or need expert guidance from someone who has seen everything, go check my website and make sure you check the pricing section. This doesn't mean I won't answer your questions without payment. If some things aren't clear, you can still text me or email me to bring clearance. So stay safe, stay informed, and I'll see you in the next video. Bye-bye.